Welcome back to Live at 9, and it was a photo finish to get Dr. Quinn in here. So he just slid in, kind of like that great broadcaster for the football teams. So tell me, Dr. Quinn, feeling fatigued, why would someone feel fatigued?
Right. There's so many reasons that a person can feel fatigued or tired. It's actually one of the most common presenting complaints that we get for patients that come to the doctor's office. A lot of it depends on so many factors, but the most important thing is the history. During this time of year with the holidays, a lot of people are stressed. Maybe they have depression, anxiety. They're dealing with family coming from out of town. A lot of people are feeling overwhelmed. This is something that we'll discuss initially in the patient encounter, and these are things that we look at.
Is it ever something that isn't being overworked? Maybe it could be something that was medical, and it's not just, oh, I've worked extra hours this week?
Right. So another factor that we evaluate is a person's medical condition. There's certain medical conditions that can make a person feel very tired or fatigued. An example would be the patient that I just saw. She's a young lady that's about 30 years old, and she has a very heavy cycle, menstrual cycle, meaning that when she has her cycle, she loses a lot of blood. She's very anemic. And the deal is, by her being so anemic, it makes her tired. So what we did was we referred her to a hematology clinic where she'll get what's called a blood transfusion. We tried her on oral iron supplements, but it didn't work for her. So once she gets her blood level up, she won't be tired anymore.
How can we tell the difference between something that is a serious medical case and maybe just the overworked? Is there a way to tell, or is it just, okay, if fatigue for one day compared to fatigue for a month?
Right. So a lot of this deals with protocols, which most medical clinics have. If someone comes in with severe fatigue complaints, our team will automatically do blood tests. We'll test their thyroid, we'll test them for anemia, diabetes uncontrolled, and then we do a host of other tests, such as heart tests as well, just to make sure that it's not a medical problem. But when you get in with the provider, then we talk about symptoms that could suggest depression or anxiety.
All right. I'm a guy that doesn't like to go to the doctor. I like to tough things out. I feel tired and I go, nope, I'm pounding right through it. We're gonna figure it out later. Or I'll feel tired some other time and try to mentally convince myself. Is there any advice you would give someone like me that just goes, okay, I'm gonna lay it to the wayside. I don't care that I'm tired. I'm just gonna pound through it?
Well, here's the deal. We don't advise anybody not to go be evaluated, because sometimes it could be something that's just starting out very mildly, and it can get worse with time. But for those out there that don't go, if it starts affecting your ability to work, then go get checked out, because it could be something underlying. Like some people might even have something as severe as cancer, which if diagnosed early, their life could be saved.
How can you tell the difference between, oh, I'm always feeling fatigued, so that's just my normal state, and it's actual serious?
The only way you can truly tell is to go to the doctor and get an evaluation to include blood work, a thorough history. For some, like I said, we do heart tests. And that way, if it's something that's potentially life-threatening, it could be diagnosed early and that person's life could be saved.